press conference, simply just to let you know and to let the public know that the Ministry of Defense takes the fight against COVID-19 very seriously. We see it as a national threat, in fact, a national security threat, when you look at what is happening elsewhere in the world. So it's about our preparedness, the steps we are taking, our role in that. So this is why we call for this. And basically, we have a national a task force within the ministry led by the deputy minister at a very high senior level in the ministry. This to show you how our seriousness about the fight and curbing the spread of COVID-19. Starting, you could see the seriousness starting from the statements of His Excellency President Salva Kiir, the President of the Republic. His first statement was on the 22nd of February. So when he was actually swearing in his first vice president and the other vice president, but his statement was dominated by this because of the recognition of the seriousness of it, and so on. He also established the National Task Force. On the National Task Force, we have defined roles. We as a ministry are a member in that National Task Force. We realized in the National Task Force that actually there is a need for us to have our own ministerial task force to deal with this, given the multiple roles for the armed forces, for protecting themselves and also continuing to deliver on their duties in the protection of the larger public and so on. The other issue that we raised, I'm not going to talk to you a lot about the directives and the resolutions of the National Task Force. You receive them on a daily basis. But I'm going to talk about the one that is having impact on our livelihoods. And this is the shutdown and shutting down some of the businesses that are non-essentials. Now, we are only having, the National Task Force have directed that only food, medicine, clinics, and things like that can be open. Other businesses are shut down. We also have a shutdown, a suspension of external flights. We have a shutdown of the borders. And eventually we also now have a shutdown on internal travels and so on. This is in the fight against COVID-19. It's having an impact on the livelihood. And this is why we also raised through the task force to the Ministry of Finance that really they should avail salaries at least of the last 3 months so that our members should be able to, to manage in this time, to be able to maybe store something little so that, they prevent the movements and so on and so forth. That for us is very important and is very essential. And we hope today that the National Task Force will resolve on the matter. So it was waiting upon the availability of the Minister of Finance, and hopefully he will be with us today in this meeting. And hopefully we would have that addressed favorably. So basically, that's a summary. Thank you.
Thank you so much. My name is Maju. I work for the Media. One, why do you describe COVID-19 as a national security threat? Two, how qualified are your staff? I mean, do you have testing kit for coronavirus in case of any case that it's happened to be in the camps? Then how do you reach out to the other members of the organized bodies in the deployed areas?
Why is it a national security threat? Just imagine if Juba was to cope. Let me just talk about Juba. Leave Yei, leave Bor, leave. Just Juba. If Juba were to cope with about 300 to 400 fatalities in a day, death in a day, how would we manage? Now in New York, you're having over 700-800 fatalities in a day. in some other places, you know how it was in Italy. We have seen corpses rotting in Latin America. Somebody was talking about they're having, the head of their family was dead for 3 days in their living room. They were calling, but because the health services were so stretched, nobody could come and help them. If that cannot describe a national security threat, if you have, in some countries now, you're having over 1,000 deaths. In only less than 2 months, the US have recorded more than 23,000 fatalities. 31,000. In any one time, in a battlefield, you don't have that number dropping. That is the seriousness. And really, when we talk about social distancing, do simple things as washing your hands and so on, and we're taking it casually. It's just we are not imagining what the situation could be if we reach that stage. Ours is really to prevent. Really, really to prevent. And even if it means we persevere in other lives, in other fields, it's better for us. Because I don't see us managing on that. On the issue of the kit, I don't think I would have given it to Dr. Rajab, but you know, yeah, before you can come actually and answer it.
I just want to add a small thing about why is it called a national security or a national security threat. If you are losing human resource, as the minister has put it, and you are losing the economy, you have seen in other places. In France, they have declared a war, so the whole army now is the one taking care of all the patients. Their military, their health facilities, Macron has put them on service to help the overwhelmed infrastructure better health in Ag. Beneath Belena, of course, we are going to request the test kits and remind them. And of course, what we are doing right now is the health education, making awareness among our forces, making awareness among our health patients, our health staff, and our patients in the hospital. Once we get the test kits, it will be very good. We know already the test kits are there for the Ministry of Health and the emergency response team, so they are the one now testing. But for the Army, we still don't have, and we know we will acquire them very soon. Once we have them, we'll be another wing supporting the effort, the national effort for this, because the Army is huge, and not us alone. Even the other security sectors will also be incorporated into our committee. So we don't have now. We hope we will get them, because the principle is you test, you trace, and you isolate. And we need the testing kits. We shall acquire them. Thank you.
Actually, in addition to that, Dr. Rajab here is a member of the technical team for the National Task Force, together in the Ministry of Health. Two things. The capacity of the testing kits that we have, or we have had, is about 30,000, which was being managed in the center. Now we have some more coming. So now we are having, actually, we even have pledges from other businesses and so on. You saw yesterday, the task force have resolved that Juba would be divided into zones. So when we expand the testing, this is when Dr. Majak and his team would be, will be having now the test kits and so on and so forth. But I'm telling you, in the next week, things will change a little, because we are receiving some more as a national task force.
Thank you so much. My name is Joe. I work for the radio community. I have two questions. I first need to know, what will your task force in the ministry do, given that a national task force headed by the president is not doing. And some soldiers has been accused by the community that they are implementing the curfew time even before 8 o'clock, chasing the civilians, harassing them, and telling them to close their shop as early as 7:30. How do you do?
Our ministerial task force is actually working towards the same goal. It's not an independent task force. It's just that, when you have an umbrella, we are not going to do anything outside the directives that are coming from the National Task Force. But we need to be able to manage things from close, because we have a lot of responsibilities. Like he just said, in France, it's declared as a war, which brought the army in the forefront. You need the preparedness. We also have a lot of men and women in this force who also need to be educated and so on and so forth, both in their contribution to the works and the implementation of the directives of the task force, and to do their own within the organized forces. That is why it is important. You now realize even the civil society they have developed something, they call it the Citizens Task Force. So creation of this is just helping the bigger, because the National Task Force can be overwhelmed and it will not be able to implement. It will be sending out directives. If it doesn't have partners in different places to oversee, to enforce, to implement, to also help, and so on. And particularly, we also have we have a very capable medical team, which also is needed to be organized in a way to channel towards the whole national strategy. What you said about the forces, we have had a few complaints here and there, and some have been investigated. But it is all about, what I can tell you is basically we will try to find ways of monitoring and countering the work of our people that are deployed out there. You have to remember that actually the deployment is the police, and the army is just a support. It hasn't reached a stage where the army has been sent out now. We have not been sent out. It is basically the police is in the lead, and so on. There were a number of, there are hotlines. There was a case, let me just tell you that, they do act when they hear reports and complaints. There was a case of maybe one of your colleagues who works for iRadio or where, who said she was harassed. And immediately, the call went to a center, and the IGP immediately, and the military police here, immediately investigated, and people were investigated and were made accountable for such an act. So rest assured, when it comes to our attention, we make sure it is addressed.